Good afternoon, Durham. I'm Rod Jenkins, Director of the Durham County Department of Public Health. This week, we have received lots of questions about the increase in COVID-19 cases within Durham County, our extended stay-at-home order, ways to be tested for COVID, and a recent New York Times article that listed Durham and Chapel Hill as COVID-19 hotspots. So in this video, I will try to address some of your most frequently asked questions about these topics. On Friday of last week, we reported 541 cases, and we will end this week with more than 700. Also this week, the New York Times listed Durham and Chapel Hill as COVID hotspots with the highest average daily growth rate of deaths among cities that it listed. I want to help you understand these numbers. First, with the significant increase in cases Durham saw this week, the vast majority are located within a correctional facility. Second, among Durham County's COVID-19 deaths as of now, 18 of 21 were located in long-term care facilities. We are taking every effort to support our detention centers and long-term care facilities, as we recognize that these sites are at high risk for COVID-19 outbreaks here and across the country. Community spread within Durham remains low at this time. Please do not misunderstand the numbers you may be reading or hearing. The fact is, thanks to our stay-at-home order and social distancing efforts, COVID spread is slowing in this community. We are truly flattening the curve. Many of you have asked why it's necessary to continue stay-at-home orders when things seem to be getting better. Remember, things are getting better because our stay-at-home orders are in place. Removing these measures too soon will put Durham residents at greater risk for increases in COVID-19 spread. Think of it this way. When you are sick or injured, it's important to continue treatment until you have recovered completely. We're getting better, Durham, but we have not recovered completely. Ending stay-at-home orders too soon will keep us from recovering the way we should, and this pandemic will only end more lives and harm our community even longer. Finally, I'd like to address your questions about getting tested for COVID-19. At this time, testing is limited to individuals who are experiencing symptoms or who are part of high priority groups as defined by the CDC, which include healthcare workers, first responders, and individuals aged 65 years or older. These individuals may call their doctor for testing or may visit a newly opened Walgreens drive-through testing site here in Durham. Please remember that testing at this Walgreens is available by appointment only to those who qualify. To find more information about this testing and to see if you qualify for an appointment, visit our website at decopublichealth.org/COVID-19 testing. I hope that I've answered some of your questions in this video. A lot has happened this week, and much of it has been confusing, and I want to remind you to rely on accurate sources of information, such as our website or the North Carolina Department of Health and Human Services, in order to make sure that what you're reading is the truth. We know many of you are growing more and more restless, so it may be hard to understand why you still have to stay at home. But please be patient and understand that these measures are in place to protect you and your loved ones. We will get through this together. We can do this, Durham.